Thank you all so much for coming today and engaging me in my fantasy TED Talk. Special thanks to Dr. Foster, who's been my advisor and mentor, and none of this would have gone anywhere without her. And also special thanks to Juliana, who worked with me as a research partner and a translator, but doesn't look like she was able to make it today. Yeah, that Juliana. So my name is Paul. I study biochemistry and molecular biology, but many of you may be glad to know that I'm not going to talk about oncology research today or anything involving cell signaling. Instead, I want you all to think about the question, how do our language and social backgrounds affect the way we move around in an urban environment? And how does that relate to our health? So this is a question that I really came across when I went to go study abroad in Shanghai for a summer. It was the first time that I was kind of out of my element culturally and linguistically. I mean, I was in a city for the first time where the majority of people I could not directly communicate with, or maybe speak on like an elementary school level. And I really began to notice how much it limited my ability to move around the city. There were areas I could go and there were areas I could not go. And as somebody who, well, particularly freshman year, liked to run a lot and to exercise, that was very limiting. There were anywhere too far off campus could pose a safety risk because if I were to get hurt or if I were to get lost, I couldn't just go up to anybody and ask for help. And with a lot of these more subtle cultural and social elements that gave me security in the United States were absent. And it may sound naive, but this was my very first time coming across a situation like this and living there for 2 months. And by the end of the trip, I noticed that I was a little less mobile. I was a little more sedentary. I hadn't run. I started gaining a little weight, and I wasn't quite as healthy as I had been at the beginning of the trip. And now I'd actually like to see if anybody would share a similar experience. Has anyone come across anything like that before? Sure.
No, my mom moved to Tennessee and she doesn't know anyone. So whenever she goes on a walk by herself, she doesn't know if she'll get hurt and not be able to get back home.
Yeah, you've got cultural boundaries. Anybody else? No?
I did an internship in Bangalore in South India last summer, and I moved there and I didn't know anyone there at all, and I don't speak any South Indian languages. So that combined with like women's safety issues in India, you know, it was I wanted to like if I wanted to go for a run. Honestly, I've hated running my whole life, and just last spring I like discovered like I just got into running, so I was really passionate about doing it. And then you know, summer rolled around, I was doing my internship in Bangalore, and I couldn't go anywhere after dark. Like, I didn't speak the local language, no one really spoke Hindi or English.
And you've lived a number of places before, right? But the big difference here was language. Or one of them.
I kind of felt that way in other places too, but I think it's compounded by the cultural, the social aspect of safety. Because I lived in Tokyo for a while, and there's an even greater linguistic barrier there. But somehow, I guess I lived there for a longer time, like almost 8 years. So then I got used to it, and I learned the language, and that actually took me a few times.
Well, there's your acculturation. Thank you guys so much for sharing. And so the thing with physical activity is it's one of the big determinants of our health. It's one of the biggest threats to health in the United States is obesity and obesity-related disease, cardiovascular disease, diabetes. And one of the two big determinants, along with diet, of obesity is physical activity. And that's not just exercise, but that's your day-to-day mobility. Where are you able to go and how much can you move? And it occurred to me, wow, this is something that people in unique social circumstances, namely people who've immigrated, really have a very different experience in. And this is actually a key issue in immigrant health. And particularly with obesity, because, like I said, there's this huge social element to the disease. And a lot of it is a disease of very much of your social environment. And a lot of new interventions in public health are looking to target this. So changing the environment to make people move more, encourage use of stairs and encourage use of biking and walking. And I was really wondering, when people come to this country, how open are those programs for them? How much are they able to experience it? Are we considering different cultures and language backgrounds when we change our environment to encourage health? And so that's an element in this project. So I decided to work primarily with the Chinese population here in Boston, partially because that was a language I had and culture I had some background in, but also because it's a population that hasn't had much study, particularly in the area of physical activity. It's a population where, so a lot of this research before has been done with Hispanic populations in Boston, some of the Caribbean and Haitian populations, and because they're generally seen as more at risk. When you look at the statistics, there's a much higher rate of obesity in those populations at the moment. One thing that you see very strongly with a lot of Asian immigrants in the United States is you get, they call it the healthy immigrant effect, and this is just one aspect to it, but you sort of see this unusual peak in terms of statistics where the immigrating population is actually healthier than the native population by a lot of the metrics that people look at. And it's really due to a whole plethora of factors, but one of them is the trading of more acute diseases for more chronic diseases in the destination country. And so that's one reason that this population doesn't appear to be at major risk and isn't a major area of research. The other aspect is very cultural. Often Asian American populations are seen as model minorities, and they're not viewed as being quite as much of a risk there. But that's not quite the truth of it. And actually, when you look at obesity rates, well, the overall obesity is relatively low. The rate of increase in the obesity is actually very high. In fact, Asian Americans have the highest rate of change in that statistic. And so this is somewhat relevant research. And so this was, so now the question was kind of, how do I go about that? What's my method? And so I had to use or design protocol for using a qualitative method, and this is my first experience with this, doing interviews and focus groups and figuring out, all right, so what are the thoughts of the people in the community? How do they feel about their level of access and programs available to them? How do they feel about their movement and physical activity? And part of the interesting thing about starting with Chinese Americans in Boston is that it's they have a strong community here in Boston. There is infrastructure. It's a big population and an old population that's been around for a long time. And it's a community that's made a lot of resources available to people coming in. And that's definitely something that I've found more and more as I was talking to people here in Boston. And it makes it a good place to start so you can learn a little bit more about what works and what doesn't work, especially if you want to branch off to other demographics. So that's where I started there. And then in terms of my methods, first off, I wanted to speak with people in the community to figure out what they thought were some of the major problems. One of the first contacts that I had an interview with Mr. Eugene Welsh, who works for the South Cove Community Health Center. He's the manager of the South Cove Community Health Center in Chinatown, which actually owns and operates a large network of community health centers in Boston and the surrounding neighborhoods that cater specifically to Chinese immigrants. And he provided a lot of insight. Their health centers put a lot of emphasis on encouraging activity. They hold classes on Tai Chi. They hold a lot of community get-togethers to make sure that people are able to move around, at least within the community, their specific community, if not Boston as a whole. And I wanted to continue to ask people because I really wanted to know on the individual level, how do people feel about moving around Boston as a whole? So that's where I wanted to begin doing focus groups. So bringing together people from the community and just asking them these questions, and more importantly, letting them discuss it. Because you can get a lot of great information when people talk to each other and share opinions and ideas. And so in terms of methods, it begins with the focus group, getting people together around coffee and a donut, and getting them to share ideas, and in this case, the donut was also providing monetary compensation. And the next, this is in conjunction with speaking to leaders in the community. So that would be Mr. Welsh. And that's the only interview I was able to do so far, but a full project would include more interviews with other professionals. And so in terms of where I was going to do the focus groups, Mr. Welsh actually directed me to one of their associated senior centers in Brighton, and I was able to set up contacts with people there, and at least at first they supported the research, but I'll talk a little bit more about that later. So the next step is to take whatever information you have in the form of interviews or notes from your work and translate it. And then the analysis consists of looking at those transcripts, finding common viewpoints, common ideas, and recategorizing them into nodes, and trying to pull out the common themes and figuring it, and maybe then you can come up with some ideas on how they relate to one another. And so long story short, in terms of my project, I began subject recruitment at the senior center in Brighton, but I wasn't able to continue from there. So I don't have too much, I have nothing in terms of data to present to you guys today, unfortunately. But I was gonna just quickly go over some of my, some of the discussion questions and see if you guys had any thoughts on them. Because this project is still something that I would really like to see continued. This, in the final form, is a proposal. It's a proposal to do more work like this and continue to ask these questions, in hopes that these can provide guidance to people who may be looking to design public health interventions for this demographic in the future. So the questions can really be broken down into what is your level of acculturation, what are your ideas on physical activity, and what do you want to see, and then how do the two relate. So I've got a couple pages of that. And like I said, my current progress is I was able to pull together the necessary information to get IRB approval, but as I began subject recruitment, it kind of ended there. And I'd like to give the rest of my time to questions. Got a couple minutes left. Yeah.
So, just asking, since you were referred to a senior center, like, and your connections in terms of subject recruitment, did you find it difficult because you wanted to get like a wider range and you only had kind of like access to one group of people, like a certain age range?
So that's a good point. Ideally, this is something that would be a phenomenon that would be independent of age. But you could also imagine how the elderly may be a more interesting group to speak with, and maybe even a more at-risk group for this phenomenon. So I didn't feel particularly hindered by limiting it to the elderly. This is a big set of questions to ask, and I found that as I was going, I actually really, to feasibly get anything done, had to continue to limit my demographic more and more. And I think that had I been able to do some interviews, I could have gotten some nice insights.
In the literature review that you've done thus far, have there been any public health interventions that you found to be particularly helpful for helping immigrant populations to get more physical activity?
A lot of people there's a lot of work that suggests any sort of intervention that's very culturally relevant and specifically within the community. So Mr. Welsh was saying that his Tai Chi classes were very, very popular.
Okay.
Any others? Yeah.
Was Mr. Welsh Chinese or other
Mr. Welsh does not speak any Chinese languages. He was actually a big guy in industry who was brought in to help design the expansion of the health centers, and he's been working there for decades, and he's the full head of the health center, and so he has plenty of guidance that help him out with that. He's really more the financial guy. All right, so that's time. Thank you all.